we have yet another confirmed case of the coronavirus in Zambia. Apparently, a 59-year-old man who arrived from Pakistan has tested positive for the virus. And officials say everyone who's been in contact with him has been traced and contacted. So now people are wondering, why are our borders still open? If there's anything that I've taken away from our approach so far, it is that our National Public Health Institute is keeping tabs on everyone who's coming to the country from these high-risk areas. And so far, there is no evidence to show that any of these infected people have transmitted the COVID-19 to anyone else within Zambia. So we have not had a case where someone in Zambia has contracted the virus from within the country. All of our cases so far are people who traveled to Zambia from elsewhere. Now, from one interview that I heard, the health minister stated that the moment they detect person-to-person transmission, or what is known as community spread, where, say, someone who had never left the country becomes infected, he said it would be at that point that they would be prompted to change strategy to something a little more drastic. And I have every confidence that our National Public Health Institute and the Ministry of Health is on top of things. Yes, we have confirmed cases, but no evidence of local contagion so far. So there's no need for any one of us to panic. However, personally, the best strategy that I've heard and adopted is that when you're around other people, act like you have the virus. And this typically means social distancing. I know social distancing has been recommended time and again, but I see quite a number of us are still not taking this guidance serious. Let us remember, it is these very few simple things that we can do that will keep us protected and keep us alive. So remember again, number one, make washing of hands a habit. Wash your hands with soap for at least 20 seconds. And if you are far away from running water, at least use a hand sanitizer. Number two, remember the coronavirus is spread through droplets from an infected person that are produced when they speak, cough, or sneeze. These droplets are said to be quite heavy and they can travel up to only about 1 meter. So that's why person-to-person transmission will often only happen between close contacts. So maintain social distancing. Make okupela meter a standard procedure. However, depending on where they are, those droplets may land on a surface like a table, which a healthy person may come and touch later. That's why it is also advised to clean any surfaces regularly, especially if you are in the vicinity of someone who's infected or someone who may be coughing. See, hands touch many things. Sometimes even like a small thing like a remote in a communal area may be contaminated. Therefore, by all means, avoid touching your face because you could easily transmit the virus from a contaminated surface to yourself by touching your mouth, nose, or eyes. Now, if you cough or sneeze, let us also learn to cover our mouths with the bend of the elbow or use a disposable tissue. Don't cough into your hand. And if you do use a tissue, discard it immediately. It is not wise to keep reusing the same piece. So remember, these are simple things that we can do to help us stay healthy. Keep hands clean, maintain social distancing, and that is the most effective way to stop this coronavirus.